Welcome, everyone, to Einstein's Eyes, our YouTube channel. I'm Carl Rosen, an oculoplastic surgeon and neuro-ophthalmologist in Anchorage, Alaska, trained at Albert Einstein College of Medicine, ergo the name of the YouTube channel. My partner and co-resident way back when, John.
Nice to see everybody. Yeah, I'm John Ditkoff. My practice is in northern New Jersey. Been there about 30 years, doing general ophthalmology and cornea. Today, I'm in Manhattan, so it's a beautiful rainy day, almost as bad as Alaska. And I guess it's a great day to do this because you guys are experiencing the rain too, right? All right, and Viral, you guys have the same weather as me, right? You're in New York, right?
Yeah, it's pretty miserable today.
Yeah, it's a good day to do a Zoom. So,
Yeah.
All right. Well, thank you, John. So today we have two special guests. They are professors at Albert Einstein College of Medicine. Anurag is a glaucoma specialist. Viral is a cornea specialist, both fellowship trained. You guys have the floor. Go ahead, Anurag.
Great. Well, thank you so much for the invitation to speak today to your audience about something that both Viral and I just love. This is something that's been a passion project for us for many years. So this is a really exciting opportunity, and we really look forward to it. So just as a quick introduction, my name is Anurag Shrivastava. I'm a glaucoma specialist in Montefiore. I did my residency training there. I went out west for my fellowship in glaucoma, and then returned as faculty. Over those years, I developed a real passion for medical education. So I became the assistant director, then I was a program director, and have more recent roles at the Albert Einstein College of Medicine as the assistant dean for the whole medical center for all of our students beyond ophthalmology, and then do a fair amount of work in our graduate medical education office for all of our residencies. But ophthalmology is still where I teach, research, and practice, and is my passion. I'll turn to Dr. Juthani.
Yeah, thanks for having me as well. My name is Viral Juthani. I finished my residency at NYU in Manhattan 9-year back in 2011. And after that, I did a couple of cornea fellowships, one at Wills Eye and then at the Cleveland Clinic. And then in 2013, I joined at Montefiore Einstein. And so it's been about 10 years here for me. So I'm a cornea specialist. I do corneal transplantation, predominantly cataract surgery, and have been involved with residency training in the surgical simulation lab. And been passionate about that, like Anurag said, for about 8 to 10 years. So it's nice to be here and speak to you about this project with us.
Well, thank you, guys. We're excited to have you. And today we're going to talk about we're going to touch on the residency at Albert Einstein. It's a great residency. John and I were involved way back when. We're going to also talk about the wet lab or the anatomy lab that allows for surgical training, microsurgery at Albert Einstein, which is fairly unique as far as residency training programs go. And this was in honor of Dr. Ron Burde, who was my chairman and John's chairman. He was a fantastic professor, chairman, who was a visionary in ophthalmology, not only in residency education, but in patient care, and really healthcare policy, innovation, and just the overall vision for the ophthalmology department at Montefiore / Albert Einstein College of Medicine. So I'm going to give the floor to Anurag and Viral and allow them to speak about the planning, the development, and the creation of the Ron Burde Anatomy Wet Lab at Montefiore, and really I look forward to this.
Yeah, thank you for that. And maybe what we'll do is, Dr. Juthani, you and I can just kind of go back and forth to interrupt what I'm about to say at any moment. So this is, like I said, a passion project for us. We've been firm proponents of surgical simulation for medical students and residents prior to entering the operating room. Dr. Juthani and I have done hundreds of cataract surgeries, and Dr. Juthani does much more now with our residents. And, one of the things that we notice is when residents come into an operating room without having practiced adequately in a safe and clean setting, their surgical skills, the way they hold their instruments, even just knowing the weight of the instruments or how much to pronate the wrist, for example, or what are the steps of throwing a proper 10 nylon suture in a cornea. All of these things can be rehearsed prior. And there's obviously, this is anecdotally and just sort of self-evident that, of course, the more you practice, the better you're going to be. Residency programs across the country, by virtue of the ACGME, which is the accrediting body for all residency programs, requires every ophthalmology residency to have a training simulation lab. They have no requirements to any of it. And I'm going to show some pictures in a moment to show where we started and where we got to. And most residency programs at this point have nothing close to what we've been able to develop in Montefiore. And the beauty of this is we've now become sort of a national and international resource, and we get calls all the time about how do we build something like yours. We even have a Wikipedia page that anybody can reference on the American Academy of Ophthalmology's iWiki page. And that article's been up for a few years now, which has videos, and we actually go ahead and describe the specs for everything that we've done. As the sort of the developers of this lab, we didn't want this to be something that only we can use. We open it up to other residency programs, faculty, community doctors, anybody who wants to learn about eye surgery is welcome to come, and it's all free for anybody. Anytime. And that is something that we believe to be a central tenet and part of our mission at Einstein and Montefiore. So we don't charge anybody for this space. And so we've funded the entire thing through donations from alumni, from educational foundations, and areas of that nature. So I'm going to pause there. Viral, feel free to jump in. I'm going to share my screen.
Yeah. I just want to be clear, this wet lab is really Dr. Shrivastava's brainchild. The amount of effort and thought he put behind this project is immense. I have the kind of the lucky role of implementing what's been built into our surgical curriculum and to use what we have to try and teach residents the best we can and kind of tinker in there a little bit. But really, all of the planning, all of the funding, and all the difficult part of this whole project is really all because of Anurag.
Very, very modest. I appreciate that, but this is the definition of a group effort, and I have to thank, our alumni and Sharon Burde, Dr. Burde's widow, who's been so generous with her time, her spirit. To this day, we speak very frequently. Whenever there's a development in the lab or the program. And she's been so generous, and the family's been generous with helping us kind of develop this space. I also want to thank Dr. Roy Chuck, our chairman, who took over. He's been our chairman at Montefiore for the last, I think it's about possibly 13 or 14 years now, who's been just a wonderful stalwart for our education program. So the picture you have up here now is a microbiology lab. It was an infectious disease lab where the lab currently sits. So this is what it looked like before. This is actually cleaned up. The prior image to this one is one that I don't show publicly because the place was in a fair amount of disarray. And so we had the entire thing cleaned and gutted. And I'm just going to cycle through some pictures just to give you a sense of the room. But this back wall that's back here is where those three big TVs are. Just remember that because I'm going to show that to you in a few slides. But those three TVs sit on this wall. This is kind of what it looked like. And the evolution of it was, this is a side room, which will become the conference room. You'll see that in just a moment as well. But again, it's a fairly standard microbiology lab that we cleaned the entire thing out, took all the equipment out, and just gutted it because that's what we needed for our spaces as we envisioned it. At Montefiore, we currently have 5 residents per year. Our program is now 3.5 years long because we have an intern year that involves 3 months of ophthalmology as well. So it's more than 3 years now. And this space is used by our Einstein students, our interns, our residents, and our faculty. So this is the conference room prior to the renovations, and just another angle of it. And this kind of shows you what we used to do. We'd throw a microscope in there and have somebody kind of sit here and try to fumble through a simulation. And that's how we started it. You get the space and then you start the project of teaching. And this is kind of where we started. This is kind of what a wet lab would look like. We'd have, pizza, and then, these are residents from some years ago. Dr. Mishra is now faculty at NYU and a glaucoma specialist. Jimmy, who's a cornea specialist who went to Hopkins and joined us. Ryan Geis is at Harvard. It's funny to look at these pictures from that many years ago, but this is kind of what it looks like, or what it looked like when we started. And obviously not perfect by any means, but it was a space that we could teach and that we could learn together.
Anurag, if I could jump in for a second,
Please.
this brings back memories. So John and I used to go to the butcher shop up in the Bronx, and we would get cow's eyes, and we would go into a lab. It was very rudimentary and primitive compared to this, and particularly what we're going to see in a few moments, but we would dissect and practice cataract surgery on those specimens. So this brings back, and it was really quite disturbing to get a head, a cow head, and bring it back to the lab and plop it down on the bench. But this is fantastic what you guys have done.
Yeah, we still use animal eyes, but now we have a nice, high-end commercial freezer and fridge and a whole setup, which I'll let Dr. Juthani talk about as well as we move along here. So again, this is the space as it was when we first just transitioned to it, just to get it started. This is a bit blurred, but this is sort of a high-level rendering that we started with, like, oh, what do we want this room to look like? What are the different functions it should do? You can see here it serves as a computer lab and a lecture hall. And then we drew some fancier diagrams and pictures and renderings, and we use this to say, okay, this is what we're envisioning. This is what we want this room to look like eventually. We want to be able to have residents come in here, do practice questions, learn from people, do telehealth. We could do, this was well before the pandemic, before Zoom and Teams became a thing that we do all the time. But this room was capable of this well before the pandemic even started. So we were really ahead of the game on that functionality. And so the room was gutted, and we kind of went through and took out every bench, really every ceiling tile, and really went through the whole space and tore it apart. Started building, and as we kind of go along here, you can kind of see the room evolve into what it is now. And this is our conference room. These are live pictures, not renderings, but you can see they look awfully similar to the drawings that we had. And this is sort of the final product of what that room looks like today. And so this is a room that's open 24/7. This is critical for our residents and students because, we all remember what it was like. These guys are on night call, they do night float. We have an apartment for them on campus that we've gutted and furnished for them, so they stay there. And if they ever want to come practice in the middle of the night, they can and do. Our residents have lunch in here together. It's become a social space. We do lectures in here. It's really just, if you build it, they will come. And I'm happy to say that they have.
That's awesome.
Dr. You want to add anything here?
Yeah. In you guys remember in residency, it's challenging to learn the skills because often we teach them at the beginning of first year. We teach corneal suturing, we teach some of the steps of cataract surgery, and then they are so busy with their other rotations that they don't do a lot of surgery for a long time, for maybe a year or so later. So the question is, how do you maintain all these skills that you've learned and are ready to be, fluent in these skills once it comes time to being in the operating room? And just having this side-by-side conference room right next to the wet lab is so helpful because when they are on night float or on call, they can just hop right over, practice some suturing, practice some capsulorhexis, and then go back to what they were doing. So it's been really helpful in that sense too.
Yeah. No, listen, I can remember I had an out-of-body experience my first cataract surgery. It was very stressful because, for the first time, you're responsible for this human being, for this patient, and it's no longer theoretical. It is real, game on, and you got to get your game face going. But I love that you showcase this, and really for potential or interested medical students that are looking at ophthalmology as a career, this is a great way to highlight this flagship anatomy lab at Albert Einstein. And I think this really highlights, just the excellence and the outstanding program that you guys have. I mean, when John and I were there, we had 6 residents. And we did our internship. I did my internship at Montefiore, actually. So that's interesting that you have 5 and 3.5 years.
Yeah, I was going to ask a question about that. Does that mean that all the residents do their internship at Monty?
Yeah, that's something we implemented a few years ago, and it's now actually a mandate that every ophthalmology program has to have combined intern or
Oh, I
transitional.
didn't know that. Yeah.
Yeah, it's a new thing. We got ahead of it. Again, we were thankfully ahead of the game. It's something I actually worked on personally when I was program director with our internal medicine department. So
But that's a requirement. That's now a requirement among all ophthalmology programs.
yeah, so now, well, it's being phased in now. I think this was the
Okay.
last year where you couldn't do it, but I think starting in 2025, all programs will be affiliated. Now, it might not be the same hospital, but it'd be the same system.
Right.
So it has to be sort of, it's one
Understood.
match essentially,
Yeah.
even though it's two matches. It's the early
Yeah.
match, San Francisco match plus the regular match.
Yeah.
But the programs are linked.
Yeah.
The other question I have is,
yeah.
in fact, we're going to be doing a Zoom in a few weeks with a couple of med students. So medical students, if they're interested in ophthalmology, they can come visit, or like, like you said, it's open to, like, how would they get in touch? Like, how can they do that?
Yeah, I can answer that. We have so many students interested in ophthalmology. This year we have at Einstein, I think we have a dozen, just large,
Wow.
the largest number we've ever had.
Wow.
And we have a cornea specialist, Dr. Richard Gibraltar, who trained Dr. Juthani, right? At some point, weren't you?
Yeah, at some point.
Yeah. At some point. So Dr. Gibraltar joined us. He was at Manhattan a year prior. Joined us 5 or 6 years ago, maybe even more now. And he's our medical student director. And so he throws laboratories where all of the medical students from the ophthalmology interest group at Einstein come over. They just did it a few weeks ago. It was a full house. I think we had,
Wow.
every station was full.
Can med students from other schools come or no?
They're absolutely welcome to. There's some challenges in getting medical students just because they have to go through the registrars at both medical schools. But any rotating student who rotates with us, who does an audition, absolutely joins us for the labs. Bronx Care, we're integrating our wet lab curriculum with them in the future in a simulation curriculum. So, we really make an effort to invite as many people as we can. Because we have the space, because it's so big, we really have a unique facility in that way. There's only a handful in the country this big.
Yeah, that's great. I will tell you that my experience at Einstein's, I did actual research. I published a couple papers with Dr. Burde and Tom Slamovitz. So while a resident, I did do research. I think I got a little heat from my co-residents, particularly the senior residents, but I did do that. And Dr. Burde encouraged that. It was a fine balance, but I think the med students should also be aware that you can continue that. You can, if you're interested in basic research, you're interested in research in general, you can do that in the program.
We actually have done research projects out of this laboratory where we'll validate different surgical simulators. We've had a recent publication in the Journal of Cataract and Refractive Surgery and some pretty high-level journals on surgical education and how to teach people how to teach and what are the facilities you need. But this is sort of how it starts. You buy the stuff and, it might be a Ferrari engine, but the body looks like a beat up pickup truck. And then you fix up the body and you get everything right. And so here's kind of what it looks like today. We've really spent quite a bit of time. Each one of these microscopes has video cameras built in. They project to these 12.3-inch iPads that we're surrounding. We have wet lab stations on the far wall with phaco machines. The professor station will show on multiple monitors, so no matter where you are in the room. There's sinks, there's a fridge, and everything you could possibly need to run a wet lab is in this space.
That is so very impressive. Wow.
It's a really highly functioning place now.
Wow.
My last few pictures are a few pictures. This is Sally Park, who's now one of our residents when she was an Einstein student. It's fun to see these pictures from back in the day. Matt Weeder is now one of our retina specialists. This is him as a resident. It's really wonderful. Here's Anthony Marte, who is going to join our faculty as a glaucoma specialist in a couple months. He went to Mass Eye and Ear and is now joining us back. Here's Dr. Juthani in action.
All right.
Who's doing the real work? We do have phaco machines. Like I said, we put the pedals, the microscopes on the wet lab side. It's important to learn to use all 4 limbs, as we all know. So using this system, we can teach the residents to learn how to control the microscope as well in a safe space. So they're not doing all the things that we know happen in surgical training. So those are all the pictures I had. Happy to entertain any questions, or Dr. Juthani, if you have anything else in our last minute or two.
Yeah, I think that was great, Anurag. Yeah, thanks for showing those photos. An amazing transformation.
Yeah, that is
I
wonderful.
agree.
I'm impressed. One question though, oculoplastics. So, how does that work with the lab? Or does it work with the lab? Is it purely anterior segment? Do you do retina? Can you do oculoplastic techniques? Levators, lacrimal, orbits.
Yeah, so Ann Bartmeller, who is our oculoplastic specialist, has taken the residents to the medical school anatomy lab to work on the human cadavers that they have in
Oh,
place. So
that's brilliant.
they do those procedures there. She does teach some suturing techniques in our wet lab, but then she takes them over there for lateral canthotomy and certain lid procedures.
That's great. That's great.
And
Because
we do intravitreal injection labs here, trocar placement for posterior plane of vitrectomy, capsulorhexis, of course, full phacos. We have all the companies, and Dr. Juthani does many of these labs. If you want to speak to that quickly on the industry sponsored labs that we do.
Yeah, that's a really good opportunity. It's actually very hard to set up phaco labs, but having the industry sponsored events makes it a lot easier. They're able to obtain a lot of the animal tissues that we need and a lot of the supplies. So those are we tend to do 3 or 4 a year, and they are about 3 hours long in the evenings on a weeknight. But they're very fruitful kind of opportunities.
that's great. That's great. Well, thank you so much.
That was really great.
That was fantastic. John, we missed out, you see?
I got to tell you, I mean, I didn't think it was that difficult. I did my first case without any of this.
No, I could have used this. I could have
Yeah,
used
no,
this.
I would have loved this. I mean, it would have made
Yeah,
my life
yeah,
much less stressful.
yeah, yeah.
And I think it would
No,
have made my attendings' lives much less stressful
right,
because
right,
they were
right,
watching me go in, not
right,
knowing if I would be successful. Yeah.
right, right, right,
It's a
right.
critical point. And one of the things, just to dovetail from that last comment, is that if you see somebody who's struggling in the wet lab, there's a pretty good chance they're going to be struggling in the real OR. So this is an opportunity to find those residents who need a little bit of extra attention in terms of technique or practice, and they can be rehabilitated before they ever see a human eye, which
Yeah,
is
very
something
smart.
that we just weren't able to do effectively before. And I want to
Yeah,
congratulate Dr. Tani on all the work he does with that, finding people and then really trying to help that.
No, it's
That's
brilliant. That's
right.
brilliant. Well, listen, I salute you guys. I'm impressed. I would love to do really add-ons or addendums to this, just highlighting maybe various subsections or divisions of Einstein and the ophthalmology department and how the residency works. Perhaps, the selection process and then the various rotations, retina, peds, uveitis, cornea, glaucoma, oculoplastics, neuro-ophthalmology. When we were back in the day, neuro-ophthalmology was Einstein's strength because of Burde and Slamovitz. And each department or each program has a flavor and a flavor of the decade, perhaps. And so I think it's great for medical students, potential medical students that are interested in ophthalmology. So you probably don't need it, but it would be great just to get it out there. And again, for our audience to know. And I think it just elevates the status and it broadcasts what Einstein can do to the public and to the world. But once again, thank you so much, guys. We're impressed. Continue your good work, and we'll see you on the next one.
really appreciate the opportunity. Thanks, guys.
Thanks. Nice to meet you guys.
Thank
All
you.
the best.